am Dr. Lakshmi Chaitanya, consultant neurologist at SLG hospitals. Today I am going to discuss about preventive aspects can prevent strokes. So some of the risk factors can be prevented, can be controlled. So there are some medical conditions like hypertension, diabetes, dyslipidemias, atrial fibrillations, some cardiac conditions. So all these conditions, if when kept under control by using the prescribed medications, can reduce your risks or chances of getting a stroke. So it's very important to consult your doctor regularly and take the medication regularly in order to control these medical conditions to prevent stroke. Other aspect is diet. It's always better to eat a healthy and balanced diet. Diets low in salt, saturated fats, trans fats, diets low in refined sugars are advised. And lots of servings of fruits and vegetables are definitely going to help you. The other issue is the physical activity. It is recommended that at least 150 minutes of brisk physical activity per week is recommended, and it's going to help you in prevention of stroke. So by taking care of all these aspects, we can reduce our chances of getting the stroke. Actually, stroke can happen to anyone, any age group, right from a baby to the most elderly old age group. All age groups can be affected, and it can happen to any person irrespective of sex. So all should be careful and vigilant. Since it can happen to anyone at any time, you should be able to identify the stroke and protect ourselves from stroke. Yeah, the stroke is actually a multifactorial disorder. There are some genetic factors along with environmental risk factors can lead to a stroke. As I said, we have the medical conditions like hypertension, diabetes, dyslipidemias, arrhythmias, cardiac disorders which can cause stroke. We also have the risk factors like age, family history, sex which can affect the stroke. We have some genetic factors which can lead to young strokes. So multiple reasons are there why we get the strokes, and that's what we doctors do. We try to evaluate the cause of stroke, and based on the cause we give the treatment, and we keep them on preventive treatment to stop getting a further stroke. Once you get affected with stroke, and after discharge, you should be really careful and take your medicine regularly in order to prevent the second stroke. Generally, most of the strokes are ischemic strokes, so we'll keep them on blood thinners and other drugs to control the secondary risk factors like antihypertensives, hypoglycemic, anti-diabetic drugs, statins, and all these things. All these drugs will help you to prevent the second stroke. And even with a healthy diet and balanced lifestyle, you can reduce your risk factors of stroke. And most important thing is it's better to stop smoking, because smoking is a very strong risk factor for stroke.